So hi, my name is Dave Stanton. I'm going to be giving an intradermal injection. So I'm going to give this according to the 6 rights of medication administration. I'm going to give the medication to the right patient, right medication, right dose, right route, right time, and the right documentation. I would do hand hygiene. Okay, so I'm going to check my MAR. My patient is Skip Rocker, birth date 1/1 of 1972. I am to give Mantu 0.1 milliliter intradermal today. Report results to MD in 48 hours. So I'm going to withdraw my medication. Not cracked, not cloudy, not chipped. Mantu expiration date is there's the expiration date, 01 of 24. So yeah, Mantu, that's my second check. Okay, I'm gonna kind of mix this by rolling it slowly in my hand. Not gonna shake it, not gonna vigorously do it, just slowly roll it. Okay, now I'm gonna remove the cap. Make sure my surface is clean here. Double OK method. For that, I'm going to take my microbial swab, antimicrobial swab, clean the cap, wait for that to dry. Now I will use the double OK method, and I will draw in 0.1 milliliters of air. Bubbles. 0.1. Okay, if I was going to take this to the patient's room, I would recap it using the one-hand scoop method, grasping at the base of it for safety. And once I got to the patient's room, I would check the patient's ID band, have him verbalize his name and date of birth. Skip Rocker, 1/1 of 1972. Looks good. Do you have any allergies? He has an allergy to Celebrex. So there's no problem there. I might ask him if he had been exposed to tuberculosis when I did some checking on this medication. It could give you a serious adverse reaction if you'd been exposed to it. It seemed to go away. But I would explain to the patient what I'm going to do. I'm going to do an intradermal injection. I would use the patient's right forearm in this instance to do the intradermal injection. So now that I'm in the patient room, hand hygiene in the patient room. Put on gloves. I would take my alcohol pad starting in the center and wipe in the center and work out, cleaning that and allowing it to dry using the double OK method. Remove the cap. Take my non-dominant hand, stretch the skin tight, making sure my bevel is up at a 5 to 15 degree angle. Insert, inject, and look for the wheel a raised wheel. Remove the medication. I would put this in a Sharps right now without recapping it. If the Sharps was available, if I had to go across the room, I would, of course, recap it. For safety purposes in my home, I am going to recap it using the one-hand swoop, grasping it low for safety. Then, if I needed to, I would take a gauze pad and place it on the wheel, not rubbing or pushing, of course, but just placing it on the wheel if I needed to. I would take a pin and draw a 1-inch circle around the wheel so that we could monitor the reaction to that and report back to the doctor as ordered. I will remove my gloves, do hand hygiene, notice my patient's reaction to the medication, and make sure the patient was all right. I would document the location, time, dose in the MAR, and that would conclude my administration. Thank you.